My name's Emma. I'm a fourth year PharmD student here at Massachusetts College of Pharmacy and Health Sciences. I'm from Mendon, Massachusetts, and I chose MCPHS because I heard about it when I was 13. My mom was diagnosed with breast cancer in my early teens, and we actually used to go do her cancer treatments over at Dana-Farber. So all of her nurses, her PAs, and her pharmacists were from MCPHS. And at that time, you're trying to figure out yourself. You're trying to figure out what you want to do with the rest of your life. And pharmacy just started to interest me. All the healthcare workers that she worked with recommended coming here. And I think the first time I stepped on campus when I was 15. And ever since, I've fallen in love with the school. I think one of the most amazing things about, going to school on Longwood Ave is you never know who you're going to meet. It's very cool to be walking next to someone and they could be carrying a red cooler that has an organ in it, or all scrubbed up, ready to go into surgery or meet patients for the day. About 2 years ago, I was coming to work at MCPHS over spring break, and I went into Starbucks to grab my pink drink as I normally do. And, I was standing next to someone, and she had this gorgeous pair of Doc Martens on. So I had to compliment her on her shoes. And then we just started talking, and I was like, oh, where do you work in the area? Where do you work? And she goes, oh, I work at Boston Children's. I work in cardiology. And I was like, oh my gosh, that's amazing. Do you have any tips and tricks on how to apply? I've always been interested in working at Boston Children's, but I want to know how to best present my application. And she goes, oh, send me your resume, I'll pass it along. So we, immediately exchanged phone numbers. And I remember about an hour later, I sent her my resume, and, 2 weeks flew by, and I was offered a job as a patient experience representative at Boston Children's in the outpatient cardiology clinic.
So if you look, there's a strip of windows above the light signals over there. That's where I work. That's where the pharmacy is in children.
I worked with scheduling patients for upcoming appointments. I checked in and checked out patients from their appointments. Probably one of my favorite things about that summer is seeing all the little kiddos come in for their doctor's appointments. They're all smiley and happy. And that's really the experience I enjoy most about healthcare, is patient care and patient interaction. The thing I love about pharmacy is the ability to treat patients and patient care, patient-centered care. Being able to impact someone's life and either give them a medication that's going to either reduce pain and symptoms or help cure a disease is a very powerful job to have. And giving someone that second chance at life or reduce morbidity or make their lives easier is just, something that warms my heart. When my mom was going through chemo, the medicine that was being pumped into her body was saving her life. And I want to give that opportunity for other families to keep their family members around.